Hello, my name is Zoltán Szabolcs. I am professor in cardiac surgery at the Heart and Vascular Center of Semmelweis University, Budapest. I am also the president of the Hungarian Marfan Foundation, founded in 2002. So, I am now going to talk for you about aortic root replacement and its indications. First, I would like shortly to discuss the anatomy of the aortic root, which is important in understanding of the disease and the surgical procedures. Aorta is the main vessel that carries blood from the heart to the body. The aortic root connects the heart to the ascending part of the aorta, and its main components are the annulus, the aortic valve leaflets, the sinus of Valsalva, and the sinotubular junction, as they are shown in this figure to the left. The coronary artery openings are also found here. The two main complications of the aortic root are aortic root aneurysm formation and acute aortic dissection. Aortic root aneurysm is the dilatation of the aortic root, and its main danger is that it predisposes to aortic dissections, the chance of which increases with larger diameters. Therefore, it's important to monitor these aneurysms, which is done by using transthoracic echocardiography, in other words, cardiac ultrasound. To prevent aortic dissection, a prophylactic surgery is required when the dilatation reaches a certain size, which I'm going to talk about in the next slide. Acute aortic dissection is a life-threatening complication with a very high mortality. It's characterized by a tear of the inner layer of the aortic wall that is followed by a blood flowing into the wall separating its layers, and it leads to serious complication. It is best to be prevented by a prophylactic surgery. The guideline of the European Society of Cardiology clearly states the indication of prophylactic surgery. In Marfan syndrome, it's indicated when the maximal diameter of the aortic root reaches or exceeds 50 mm, and this value goes down to 45 mm in case any of the following presents: aortic dissection at low diameter in the family, desire for pregnancy, the growth rate is 3 mm or more per year, finally, the presence of severe aortic or mitral regurgitation. In patients with TGFBR1 or TGFBR2 mutation, including Lloyd-Dietz syndrome as well, surgery is needed if the maximal diameter of aortic root is 45 mm or larger, and the procedure should be considered at the lower threshold of 40 mm if all of the following present: women with low body surface area, TGFBR2 mutation, and finally severe extra-aortic features. The applied procedure is the aortic root replacement, which has two types: aortic root replacement when the aortic valve is not preserved, and valve-sparing root replacement. The latter involves the David and Jakub techniques. The main steps that are common in the two types of surgery are the following. First of all, we perform a median sternotomy to gain access to the heart. A vertical incision is made along the breastbone, after which the breastbone is divided. A cardiopulmonary bypass machine is used to replace the function of the heart and the lung during the surgery. The dilated part of the aorta is excised and replaced by an artificial graft. The aortic valve is either exchanged or kept depending on the type of procedure. The coronary vessels, which is responsible for the heart's blood supply, are reimplanted into the graft. The main aortic root replacement procedure is the Bentall one. It's chosen when the patient's aortic valve cannot be preserved due to calcification or severe insufficiency. During the surgery, the aortic valve and the dilated part of the ascending aorta are replaced with an artificial graft. Based on certain criteria, the implanted valve can be mechanical or biological. When a mechanical valve is implanted, lifelong anticoagulation is necessary to prevent blood clots formation. The main steps of the operation are shown in the figure. The other type of surgery is valve-sparing root replacement, which involves the preservation of the patient's own aortic valve. It can be carried out in patients with suitable aortic valve anatomy and a valve that is spared by the disease, meaning that there is no severe regurgitation, no calcification, and the valve is not sclerotic. Valve-sparing root replacement has two well-defined techniques. The David operation is characterized by the reimplantation of the aortic root, while during Jakub surgery, the aortic root is remodeled. The difference between the two techniques are demonstrated by the figures. It is very important benefit of valve-sparing root replacement that lifelong anticoagulation is not required. At this slide you can see some intraoperative photos. The left picture shows the dilated aortic root, while the other two photos present the preserved aortic valve at the bottom of the implanted plastic tube. This slide shows the summary of the root replacement techniques. The Benta procedure, which involves the replacement of the aortic valve, provides an efficient correction of aortic regurgitation, and its other benefit is that it has a lower reoperation rate than the valve-sparing techniques. The main risks after Benta surgery are thromboembolic events and bleeding complications. The main and most important benefit of the valve-sparing David and Jakub operation is the fact that lifelong anticoagulation is not required. However, reoperation due to aortic regurgitation is possibly more frequent after these procedures. And finally, here I am going to provide some practical information. Prior to surgery, patients need to undergo a number of examinations, which include, for example, dental exams, lab tests, and different imaging studies. The length of an aortic root replacement procedure is usually 4 or 5 hours. After the surgery, patients stay in the intensive care unit. The total length of hospital stay is about 1 week, which is followed by around 2 or 3 weeks of rehabilitation. The total recovery can take up to 2 to 3 months. After the operation, regular follow-ups are required, involving echocardiography and CT scans. I do hope that this presentation helped you to understand the basics of surgical reconstruction of the aortic root. Thank you very much for your kind attention.